Welcome, everyone. In this video, we'll show examples of selecting relevant sources for our two research questions, appraising them according to the AOA Clinical Practice Guidelines, and determining what information they provide to help answer our research question. First, we'll select sources for our first clinical question: how effective is the 20-20-20 rule in reducing digital eye strain? This is a therapy question, so we're ideally looking for meta-analyses, systematic reviews, or randomized controlled trials. And if we can't find them for this question, we'll look at the highest grades of evidence that we can find. When we searched the different background sources, we didn't find any information about the 20-20-20 rule, and we only found a little bit of information about digital eye strain. So let's start our search for external evidence. We'll start off by going to PubMed by clicking on the link from the evidence-based optometry page of the Optometry Resources Guide under Find Where to Look for Evidence, and we'll search for the 20-20-20 rule. Let's click Advanced under the search box, and we'll click the chevron next to our search to see how PubMed is interpreting our search terms. It looks like it's just searching for these two words as keywords, and that there are 10 search results. So for this search, it seems like searching simply 20-20-20 rule is enough because there are so few articles about it that we can look at all of them. We will click on the 10 to see the search results. And since we're ideally looking for meta-analyses, systematic reviews, and randomized controlled trials, we can try clicking these filters. However, when we do this, we get 0 results. This is because there are none of these types of studies within our search results. So we'll clear those filters and then look at the studies that we do have in our search results. The existing articles are probably not at the highest levels of evidence that we're hoping for, but we'll see what's available. We'll start by clicking on the article 20-20-20 rule, are these numbers justified, published in 2022. We'll click Access at PACU to get to the full text, and we'll click Cite to get the citation in APA 7th edition. We can get the permanent link to this article if we click Permalink. And it looks like there isn't any full text for this article, so we would click Request it through Interlibrary Loan. Then we sign in with our Pacific username and password, and we'll be taken to an interlibrary loan form that has already been completed for us, and we just need to scroll to the bottom of the page and click Submit Request. However, before I request items through interlibrary loan, I usually like to see if I can find them freely online through Google Scholar. So I'll click the link to Google Scholar from the evidence-based optometry page of the Optometry Resources Guide. And while you can search Google Scholar freely without linking from the library's page, when you do click the link from the library's website, if there is full text at Pacific, it will link you back to the full text at the Pacific University Library, or offer you an option to request the article through interlibrary loan. So I go to Google Scholar and then paste the title of the article and click search. I click the link to the right to get the freely available text. And here is the freely available version, so we don't have to request it through interlibrary loan. So now we'll read the abstract to see how relevant it is. We can see in the methods section that it is testing having people take 20-second breaks at different intervals when doing cognitively demanding reading tasks from a tablet computer. This seems to be right on topic. Let's also look at the study's results and conclusions. It states that there is no significant effect of scheduled breaks on reported symptoms, reading speed, or task accuracy, and concludes, while widely cited as a treatment option, these results do not support the proposal of using 20-second scheduled breaks as a therapeutic intervention for digital eye strain. To determine what type of study it is, let's look at the methods section where it states, this study was carried out on 30 young subjects who performed a 40-minute cognitively demanding reading task from a tablet computer. It sounds most like a non-randomized trial, and it would be grade C evidence according to the AOA Clinical Practice Guidelines. Next, we'll look at the effects of breaks on digital eye strain, dry eye and binocular vision testing, the 20-20-20 rule published in 2023. So first, we can click the Cite button to get the citation in APA and copy and paste the web address. It looks like this article is open access, and so we can click the link to the full text directly from the publisher, Elsevier. We'll go to the full text of the article, and if we'd like to get the PDF, we can click the button in the top menu. Then we see the PDF of the article, and then we can download it if we like. If we look at the abstract, we can see they're testing the 2020 rule. They write they're using computer software using a laptop webcam to assess user breaks, eye gaze and blinking, and emitting reminders of breaks based upon the 2020 rule. Digital eye strain, binocular vision, and dry eye were assessed before and after 2 weeks of using the reminders and 1 week after the discontinuation of the strategy. However, their results are different than those of the previous study we looked at. They find that digital eye strain decreased with the rule reminders, although this improvement was not maintained when after discontinuation. And they conclude that the 2020 rule is an effective strategy for reducing digital eye strain. We would want to ask ourselves why the results might be different. Is there something about the study designs that might have made the difference in the results? It could also be because of their population, the severity of the symptoms of their population, or because of random chance. We'll also note that both of these studies are done on very small populations. So this is why it's important to have many studies done so that we can see the overall trend and to notice any differences in study design. Looking at the study design, it also appears to most closely fit the description of a non-randomized trial. And so it would be grade C evidence as well. So at this time, we have two conflicting non-randomized trials, which are both low grades of evidence. These two studies appear to be the highest levels of evidence at this time. So let's look at some of the other articles. We'll look at the article, Effective Digital Device Used During COVID-19 on Digital Eye Strain, and published in 2021. We'll click Access at PACU. And we'll also get the citation in permalink and then request it through interlibrary loan. I already checked, and this article is not freely available on Google Scholar. We can see that this one is indirectly on the topic of the 2020 rule. It looks at the duration of screen time and associated symptoms, but it does not directly study the 2020 rules. The results are related, but not directly about the rule. They did a multivariate analysis and found significant associations between digital eye strain and the following factors: using more than one device, age, optical correction, employment status, gender, using rewinding drops, and usage duration. Usage duration is the only thing remotely related to the rule, and they conclude in this population, prolonged use of digital devices significantly increased during home isolation, and they encourage individuals to practice the 2020 rule. However, this recommendation is not the result of their study, since they did not include use of the rule as a part of their study. To look at the study design in the methods section, we can see that it was a self-reported questionnaire used to compare the total hours per day, either continuous or intermittent, spent on digital devices during and before curfew, and the association of these durations with digital eye strain. This would be a cross-sectional study since it involves surveying a population about exposure, condition, or both at one point in time. Based upon the study design, this would be grade D. This is the lowest grade of evidence. Finally, let's look at the article Digital Eye Strain, a Comprehensive Review, published in 2022. The article says there is free full text through PubMed Central, so we'll click that link, and now we could read the full text. We could get the citation, copy the web address to the article, and also download the PDF. So this article is not a study. We can see that it does not have the sections that studies have. It might be a good background source, and so we're going to do a Control F search. It would be Command F on a Mac, and see if it mentions the 2020 rule. We can see that it discusses this rule as a treatment option for digital eye strain, and if we look at the reference for this by clicking the number in the text, we'll see the full citation for the reference and a link to the full text in PubMed Central. Now we see the article Managing the Myopia Epidemic in Digital Eye Strain Post-COVID-19. However, this study is not a study and is also a review. So if we do the same, again, to see where the 2020 rule is mentioned, we can click on the number for the reference again and see where it's listed in the reference list, and then get to the article in PubMed. And now we see that this is another review entitled Management of Digital Eye Strain and published in 2019. So maybe if we go back far enough, we might find an actual study somewhere, but so far it's just reviews citing other reviews, which is not good quality evidence. So reviews are grade D. At this point, we could look at the remaining articles in the 2020 search results and save any that were relevant. We could come up with an additional with additional search terms and look at articles in those results. As we were reading through the article 2020 rule, are these numbers justified? And we saw that they use the term 20-second scheduled breaks. So we could try adding this to our search string. We could try the search string 2020 rule or 20-second scheduled breaks or 20-second breaks or scheduled breaks or breaks and digital eye strain or computer vision syndrome. We would paste it into the search box, click search, and then click advanced under the search box. And then we would click the chevron next to this search in the history and search details section. Now we can see how PubMed interpreted the search string. Some of the keywords and mesh terms it used for schedules and breaks didn't seem very relevant. So at this point, I could revise my search string until I find keywords that PubMed is interpreting the way I want it to. I could also click the number 62 and get back to the search results, and then look through them and see if they're relevant or not. So, because they might still be on topic. Additionally, for articles that we have found, we could look in their references and look at cited by and similar articles recommended by PubMed. We would stop searching when we feel that we found the most relevant evidence for the topic. For example, if we're no longer finding articles that are on topic, or if they are lower grades of evidence. At that point, we'll continue to other databases and follow similar processes until we see if we find additional articles. So I'll quickly show you an example in Vision Site. And so we'll log into Vision Site and we get the username and password by clicking Get Login. We'll use the search terms 2020 rule and click search. So then we select Vision Site from this search box drop-down menu and click search again. And then we would see the search results with Vision Site written over each one. And so we know we're searching the Vision Site database. So let's look at the first search result, 2020 rule, when good intentions and axiomatic habit displace best practices. And we'll click on the title. Next, we'll look for a link to the full text, total access at Pacific U. And here we find that there's no full text, and we see that a link to request it through interlibrary loan, and we can also get the citation. If we search for it on Google Scholar, we would see a link to a freely available version that we can access. So looking at the abstract, we can see it's not a study since it does not have the methods, results, and conclusion sections that a study would have. It seems to be a position paper since the abstract states, while offering trite advice to address potentially serious concerns might appear to be helpful, the 2020 rules continued use could well be displacing other more appropriate management strategies. This paper addresses some concerns regarding the promulgation of this well-meaning but misguided advice. So this would be a grade D evidence. Let's go through the same process for our second clinical question. How effective are omega-3 fatty acids in reducing dry eye? This is also a therapy question, and we're also hoping to find meta-analyses, systematic reviews, or randomized controlled trials. For this question, we're going to find higher grades of evidence because there's more research done on it. So we're going to start off by looking at background information, and we can look at Will's Eye Manual under the background sources of the evidence-based optometry page under Find Where to Look for Evidence. We'll click the link to get to the full text and then search within the book for dry eye syndrome. We'll look at the first search result and see a section about dry eye syndrome. If we do Control F, we can see that it says that oral omega-3 fatty acids may be beneficial for moderate to severe dry eye syndrome. Next, we'll click the link to Up to Date and we'll search for dry eye disease. We'll click the first search result entitled Dry Eye Disease. We find a broad overview including epidemiology, clinical significance, pathophysiology, causes, symptoms, diagnosis, initial treatment, and ophthalmology evaluation and treatment, information for patients, and a summary and recommendations, and finally references. Again, we can do Control F to see where it mentions omega-3, and we see it in the text in one location, omega-3 fatty acids. Trials of omega-3 fatty acids for dry eye disease have shown mixed results, with a large multi-center clinical trial showing no additional benefit of omega-3 fatty acid supplementation over the placebo of the improvement of dry eye disease signs and symptoms. Next, we'll click the link to Clinical Key, and we'll search for dry eye syndrome and click Show More under the source type. We'll limit the results to clinical overview since that's what we're looking for at this point, and we'll find one clinical overview about dry eye and click on the title. Again, we can search to see where it mentions omega-3 fatty acids and see what it says. So here it states that data have shown mixed results and they provide several citations. The last background source we'll check is Access Medicine, and we're looking in medical textbooks and we'll search for dry eye syndromes. We can see that there is a patient education for dry eye syndromes and a section on dry eye syndromes in a chapter on conjunctiva and tears in general ophthalmology. This section has information about etiology, clinical findings and complications, and treatments. So after looking at these 4 sources, we should have a basic overview of dry eye syndrome and some of the common treatments. And so next we can look up the latest evidence in PubMed. So we'll click on the link to PubMed, and we'll start off searching PubMed for dry eye and omega-3. We'll click Advanced under the search box in the search results page. To see how PubMed is interpreting our search, it has a warning, and it apparently doesn't like that I use the Boolean and A&D in lowercase. However, it appears to have interpreted the search results correctly, so I don't think it really matters. But I just changed it to the and in all capitals for good measure. Let's just check the MESH database to see what the dry eye syndrome MESH term includes. We'll click MESH database under Explore on the PubMed homepage. And when we search for dry eye syndrome, we see that the definition of the MESH term is corneal and conjunctival dryness due to deficient tear production, predominantly in menopausal and postmenopausal women. Filamentary keratitis or erosion of the conjunctival or corneal epithelium may be caused by these disorders. Sensation of the presence of a foreign body in the eye and the burning of the eyes may occur. So this looks correct. There are 194 results, and we'll limit our search results to meta-analyses, systematic reviews, and randomized controlled trials. So we now have 50 results, and they look fairly relevant according to the titles. First, let's look at efficiency of omega-3 fatty acid supplementation for treatment of dry eye disease, a meta-analysis of randomized controlled trials published in 2019. We'll click Access at PACU, and we can get the citation and permalink to the source. We would need to request it through interlibrary loan. If we check Google Scholar, we can get a freely available version, and so we don't need to request it through interlibrary loan. And here is the freely available full text. Looking at the abstract, we can see that it is on topic, and it's a systematic review that also includes a meta-analysis, and it is right on target for our topic since it's looking at randomized controlled trials for omega-3 fatty acid supplementation used to treat dry eye disease. They found that omega-3 fatty acid supplementation significantly improves dry eye symptoms and signs in patients with dry eye disease. And they concludes that omega-3 fatty acid supplementation may be an effective treatment for dry eye disease. Assuming that the meta-analysis had a good study design, and so did the studies that they included in it, it would be a grade A. So this is the highest level of evidence because it's looking at many previous studies and using statistical analysis to summarize these studies. We'll look at one final study, a randomized double-masked, placebo-controlled clinical trial of 2 forms of omega-3 supplements for treating dry eye disease, published in 2016. So to get to the full text of the article, we'll go to Access at PACU and click the link to the full text. This study is a randomized controlled trial. It looks at the effectiveness of 2 different forms of omega-3 fatty acids for treating dry eye disease, and it found that a moderate daily dose of both forms of long-chain omega-3 fatty acids for 3 months resulted in reduced tear osmolarity and increased tear stability for people with dry eye disease. So this article is a randomized controlled trial and is probably a grade B because it includes only 60 participants. However, we could look at other aspects of the study design to make a further determination. So we have seen that for our second clinical question, there has been a lot more research on the topic, and we're finding higher levels of evidence and even systematic reviews with meta-analysis. The last step is covered in the next video. And so remember to contact me or the library help options with any questions or to work on your research.